Yeah, a very good afternoon to all, and thank you, AIOS, for giving me this opportunity. I cannot see my presentation. Dr. Shweta Tripathi.
Any questions from the audience? You can please put forth. So, in the diagnostic tests that was all mentioned, so, OCT plays an important role. And as Dr. Dilip said, we need to consider clinical skills too. So, you can't simply overlay on your whatever diagnostic tests show, because all imaging devices have their pitfalls. So you should know those. So it's not a substitute for your clinical skills. Yes, please ask.
Uh, just like to give a comment. I'm not an ophthalmologist. I'm a clinical geneticist. But I'd just like to give to respond to the comment you made about patient. Patient is the decider of they make the final decision. So I think I fully agree with that. I think that is the basic principle of giving counseling to a patient. I think we give all the information, provide all the information to patients, and they make the final decision, the informed consent. And I think it's similar. I'm from Malaysia, and I think the situation is similar in Malaysia. Normally, patients tend to ask the doctor, to decide for them,
Yes,
and I
yes.
think we should avoid that. I think the message is that we should always avoid to decide for the patient because, well, if anything goes wrong, the patient may turn around and blame the doctor. But I think that is against the basic principle of counseling. We should always avoid to make decision for the patient. It's a
Yes,
comment from
yes,
me.
correct. You need to spend that extra 1 minute to explain to them and then let them take the decision.
Thank you.
Thank you.
Thank
Over to
you.
you.
So, a very good afternoon to all. And today we are going to cover a very important topic when it comes to the field of glaucoma management. Talking about the compliance, we all know that the prevalence, when we talk about India, it's about 11.2 million, covering all the different types of glaucoma. The basic challenge when we face about glaucoma diagnostic is whether it's going about the underdiagnosis or a late diagnosis or a over treatment. But everything comes down to the same point. That's how do the patient is complying or adhering to the treatment. So let's talk about the compliance or the adherence. So there was a study, different studies which said that the main cause for the being the patient non-compliant or non-adherent was lack of knowledge about the disease, lack of like ignorance led to the poor health seeking behavior, awareness, everything was lapping. So we as a treating glaucoma people do have an additional responsibility of making our patient more compliant, adherent, and persistent. So why do we need to address this compliance so much when it comes to glaucoma treatment? Does it really affect the treatment protocol? And the answer to that comes definitely a big yes. Why? Because when we know that the glaucoma treatment is a lifelong therapy, which might lead to an unnecessary burden on the pocket, compromise the quality of the life. So a unhappy patient leads to an unhappy doctor as well. So definitely none of us wants to be unhappy. It leads to unnecessary decision making of investigation or a surgery. Simplifying the terminology, there's a difference between a compliance and an adherence. Compliance is a one-way procedure, like you tell the patient has to comply by it. And adherence is that the patient is a two-way, bi-directional process. You tell the patient, make a patient part of the treatment regime, and then you say, okay, this is the treatment strategy, and the patient has to adhere to it. So basically, from here onwards, we are going to use the term adherence. So now, because we all know the goal of the treatment is definitely not only about reducing the IOP, it's about giving the patient a good quality of life as well. So there are certain questions which we should keep in our mind before starting the glaucoma therapy. That if the patient is for the first time a glaucoma patient, definitely you need to spare some more time for that particular patient. If the patient is taking more than one glaucoma medication, they need a combination therapy. Any systemic medication they are taking, because we know that the systemic and the topical antihypertensives, they do have some interference with the action of each other. Allergy about, especially about the alpha agonist or sulfa allergies. The ease of administration, because squeezing a bottle would not sound a big task to us, but just think about a patient who is having a problem with the dexterity, or elderly patient. Squeezing that bottle means a lot to that particular patient. The patient's use of contact lens, and the patient is pregnant or breastfeeding. So with the different dimensions of adherence, again this was a further study which said that the most common cause of the patient being non-adherent was the side effect or the lack of awareness. So if we want to divide this non-adherence, we can broadly divide it into two categories. One would be the unintentional, that's the practical barrier, or the intentional, that is the perceptual barrier. So if we talk about the practical barriers, most of them we have covered already. That's the complexity of the regime, the cognitive barriers, the physical barriers, the patient education, and the patient lifestyle. Because we cannot imagine a company CEO putting a drop thrice throughout the day. So you have to titrate according to the patient's need. It is not a rule of thumb that for everybody you have to just give thrice BD or HS drug. You have to just titrate, keeping the patient's lifestyle in your mind. So the most important point what we face in glaucoma is the communication difficulty between the patient and the physician. So that is what I've been emphasizing from the very beginning of this session. Please try to spare some extra minutes for your glaucoma patients. Talking about the unintentional non-adherence would be that what are you going to do in that particular, I can say the objectives, how you can overcome them. Provide a verbal information, online video, written information. Regime has to be titrated. The bottles, the labeling can be done on the bottles, or for the patients who are having dexterity problems, the dose administration aids are there. Always teach your patient about the punctal occlusion. That's really important, which will reduce the systemic absorption, and definitely that is going to give a higher efficacy of the drug. Talking about the intentional non-adherence, educate your patient not only about the disease, it's about the drug side effect. And you tell the patient, because in any eye treatment or any treatment, the common belief is that you take the treatment, the benefit is there. But in glaucoma, actually it is not the patient who is going to get the difference in the treatment, what is going to gain out of it. It is us who is going to teach the patient that every time you come to us, we are telling you that you are progressing or the disease is stable. So the need of the eye is definitely going to be keeping a balance between the concern and the necessity. And the concern for glaucoma patients are side effects, disruption of the daily activities, or the glaucoma is asymptomatic in nature, so it's not giving anything. I'm sure that none of us wants our patients to be like this. So definitely we have to tell the patients, warn the patients about the side effects already. Then we have to take care of the preservatives. And in all, I can just summarize saying that early detection, assessment, strategy, and education. And last but not the least would be the follow-up with reassurance will definitely lead to with a healthy and a happy patient along with a happy doctor. Thank you very much.